Hi, so today we're going to look at a quick and simple alternative method for removing contraceptive implants that health professionals can use. This method, as well as being simpler, quicker, it can also be used for more difficult to locate contraceptive implants. This method uses a vasectomy ring clamp rather than the standard artery forceps. The ring clamp has perfect shape at the end, not only to encircle the vas deferens, but also to circle around a contraceptive implant. So by using this, we can encircle the implant around the mid section rather than at the end to ensure that we grab it more simply. So let's go through that technique. The first thing we must do before even starting is to palpate the implants to make sure that you know where they are and you can feel them, whether there's one or two depending on the device that's been used. Once I've palpated those implants, I'm then going to mark on the skin where they are so that when I use the local anaesthesia, I don't lose my bearings as to where I'm going. Next, I'm going to wash over the area with an antiseptic solution to ensure that the area is sterile. I'm then going to inject a local anaesthetic. I use 1% xylocaine. I don't bother using adrenaline in this case, although you could do to minimise bleeding. Firstly, I will raise a bleb at the surface of the skin. Once I've raised the bleb, I'm going to extend the local anaesthetic into a point around about 1/3 along the length of the contraceptive implant. In this case, we have 2 implants. So we're looking to make the incision here about 1/3 of the way along the implants at a point where they are both still relatively close together, but where there is implant either end of where I have made the incision. If you're doing this with a single implant, then obviously you would go straight over the top of it rather than in between. Once the patient is numb, I'm then going to make an incision with a scalpel and make sure that I extend that incision large enough to take the diameter of the end of the ring forceps. I will extend with the scalpel towards where both of the contraceptive implants are, being careful not to cut through them. I'm then going to place the ring clamp into the hole that I've made in the skin and advance it towards one of the contraceptive implants. Then with my other finger of the other hand, I'm going to apply lateral pressure so that I can palpate the implant in one hand and push towards it and put the ring clamp around it from the other side. So I'm going to push it into the jaws of the ring clamp. I'll bring it up to the surface, and in this case you'll see the contraceptive implant just pop straight out. I'm then going to alter the position and push the ring clamp towards the other contraceptive implant in this case. Again, although you can't see it in this one, I'm applying pressure to the lateral side of the implant and medially pushing the ring clamp towards it. So it's trapped between my external finger and the ring clamp. I'll bring that up to the surface. And in this case, you can see there's a little bit of connective tissue still around that and it's not coming out cleanly. So I'm going to incise through that connective tissue, but I'm going to make sure that I'm cutting along the length of the rod than across it, because then my chance of severing the rod and cutting it into 2 pieces is very, very small. You can see if I do this gently, then I can expose the rod through that connective tissue and I can grab it with a second ring clamp and pull it out. This then just leaves us with a small hole the size of the head of the ring clamp, which I can apply pressure to, apply a dressing, and then a bit more pressure on top of that with a bandage to reduce bruising. There is no need to suture this wound. It will heal up beautifully without any further suture. So I hope that was helpful for you. It's certainly a quick way to do it. This particular case took about 2 minutes to remove, and it certainly makes things a lot easier.